Wonderful. Good morning, everyone, and welcome to today's session. My name is Dion Kokarapia, and I will be moderating this session today. And the session is entitled Redefining Success Through Community-Based Outcomes. But before we jump in, I am going to take care of a few administrative slides, and then I'll turn it over to our presenters. Next slide, please. Next slide. Thank you. This training today is a part of the Intact Community Wellness and Peer Support Transformation Team's Training Academy. Next slide. One second here. And we hope that you all will visit our website so that you can learn more about our Training Academy, which is a new initiative that we created this year. And we're really hoping to bring a lot of mental health training to the community. So there are numerous other trainings that will be delivered for the remainder of the summer. So please check out our website so that you can take a look and see if there are any trainings that you might be interested in. A brief disclaimer is that our work is being sponsored by SAMHSA and the U.S. Department of Health and Human Services. Next slide. And regarding security, in case of any security issues that may occur, this session will immediately end and then will not resume using the same link, and then a separate email link will be sent to you to rejoin the session. And this is a list of some of our wonderful partners, our Intact partners, which is National Training and Technical Assistance Center. And all of these partners play an integral role in making sure that we are able to provide these trainings and other relevant mental health information to you all throughout the year. So just wanted to honor our partners. Next slide. And it's really important for us to share our vision and services. And I'll just read this because it's really important. Our vision is that all children, youth, and families living with and impacted by mental health challenges will have access to the resources and opportunities they need to thrive in a comprehensive and equitable system of care. Just to touch on some commonly asked questions, and I think I may have seen some in the chat already. Everyone will receive a certificate of completion automatically following the presentation. And you will also receive a copy of the presentation within 2 business days following today's training. And you also receive the recording as well. So you will receive everything that you hear here today. So no worries. Next slide. And another wonderful opportunity for you are continuing education hours. Once you complete the evaluation survey, which will be sent to you all following this training, you'll be redirected to our CE hours form. So if you are interested in continuing education hours, please complete the survey and then request those continuing education hours. So welcome to today's session. Again, the session is entitled Redefining Success Through Community-Based Outcomes. And today's presenters are Lacey Coyne, Brooke King, and Lillian Gwynn. And I'm going to read their bios, and then I will excitedly turn the presentation over to our presenters. Lillian Gwynn is the Director of Policy, Systems Coordination, and Programming in the Texas Health and Human Services Commission, HHSC. Office of Mental Health Coordination, where she oversees several initiatives, including the Texas System of Care, Community Resource Coordination Groups, Trauma-Informed Care, and Mental Health First Aid. Previously, Ms. Gwynn was the Texas System of Care Project Director, and in this role became familiar with the essential community responsibility of schools to improve the mental health of students. Ms. Gwynn earned a bachelor's degree in psychology from the University of Connecticut and a master's degree in clinical psychology from the University of Hartford. Welcome, Lillian. Next, we have Brooke King, who is the Director of Policy and Prevention Strategies at the Prevention and Early Intervention Division of the Department of Family and Protective Services. For the past 16 years, she has worked to develop strategies, programs, policies, and practices to promote safe, stable, and nurturing communities and resilient families locally and statewide. She holds a bachelor's degree in psychology from Texas A&M University and a master's degree in clinical psychology from Stephen F. Austin State University. Welcome, Brooke. And last but certainly not least, we have Lacey Coyne, who is the Director of Supporting Mental Health and Resiliency in Texans, which is an acronym for SMART, the Innovation Program, which is a new competitive grant program to support a variety of upstream community-based initiatives that promote identification of mental health issues and improve access to early intervention and treatment for children and families. Lacey has 14 years of experience overseeing state programs, leading strategic initiatives for family-oriented programs, and supporting executive staff, operations and government, relations in various roles across HHSC, the Texas Education Agency, the Texas State Board of Education, and the Texas House of Representatives. Welcome, Lacey. And I will turn it over to you all to begin your presentation. Thanks again to everyone for joining, and welcome again to our presenters.
Thank you. So today we're going to share our progress in Texas, and we're hopeful to have a discussion with you all in our direction. If we're heading the right way, if there are strategies that are working best for you, and any assistance or guidance that you have that may support us as we're moving towards redefining success and community-based outcomes. And so in order to do so, we're going to go through our purpose and goals for Texas, what we found related to the importance of early mental health prevention and intervention in Texas, share some background on current efforts across our community-based programs, the lessons learned and innovations we're implementing now, and the discussion and finally closing. So I'm going to go ahead and get us started. Purpose and goals for Texas. So while Texas has made an unprecedented commitment to the public mental health system, it's true now that we are focusing largely on crisis services or treatment for those with serious mental illness or a serious emotional disturbance. And while critical, these services treat the symptoms and do little to mitigate these risk factors that lead to the need for more intensive treatment services or potential adverse outcomes for children and their families and their communities. And not only are these services critical, but shifting too much to that prevention side can leave those that are really needing help now behind. And so we're trying to balance that out here too. We've been focusing on cross-sector partnerships and flexible reporting to help our communities innovate themselves to address their unique landscapes, inspire continuous improvements, and foster resilience across our state systems of care. Texas is working towards growing upstream community-based interventions, maintaining and even strengthening current intensive efforts, focusing on supports for family systems, and leaning into community outcomes to demonstrate success. And next we have a poll before we get deep in the weeds. We're wondering who's in the audience today. And I'm just going to give one less minute, if it's okay for me to go ahead and move on. One more minute, not less. I love that people are sharing their states and areas in the chat. This is really helpful for us. Thank you so much. Thank you.
And then
All right, well, I'll go ahead and move on to talk a little bit about the Texas landscape. And what we look like here. And thank you so much for sharing. It looks like we have a lot of mental health professionals. It's a pretty even spread, actually. Okay, so in order for us to have this discussion, we wanted to share a little bit about Texas. In case you didn't know, we have 254 counties, and we have 3 of the top 10 most populous cities in the US. And we're a large state, of course, that's home to a diverse array of families and includes the full population continuum from rural to suburban, urban, and frontier areas. And each community is different. It has its own unique needs. And for example, this spring, we've been visiting several communities in Texas to understand their local continuums of care and what those unique needs look like. And I've seen interesting results. In major cities, we may see an abundance of resources, but challenges with lack of awareness or guiding through those systems. One of the more interesting things that we've seen with some of our rural cities that are surrounded by even more rural counties like Amarillo or Longview and Tyler, they brought up challenges meeting their own needs in these smaller cities, but the demand is pulling from those outlying counties and it's straining their existing resources even further. Almost all areas that we visited were impacted by transportation, provider shortages, and additional infrastructure barriers, with some needing to travel across the state to receive the services that they need. And we have a growing youth population. We're home to 10% of all children in the US under 18, and that's nearly 7.5 million children living in Texas. In Texas in 2022, 73% of youth with a major depressive episode did not receive any mental health treatment. Sorry, the chat's over there. And in Texas, a lot has been done in a short amount of time with huge investments made. So at the state level, we've been working together and building partnerships, which has improved our understanding of local needs and that we are really working towards those same goals. And through these partnerships, we've learned that there's a high cost of adverse outcomes, such as more intensive mental health care services, juvenile justice involvement, and child welfare. We've learned from our partners, one being Brooke on this panel, that there have been a demonstrated high return on investment through their prevention and early intervention programs. And more importantly, the benefit to each individual in Texas receiving these services to potentially avoid long-term or even a lifetime of adverse outcomes to attain higher quality of life. The large and growing population of youth in Texas compounds the importance of these services. And I'm going to turn it over to Brooke to discuss some background on the work that's been done so far in Texas.
Sorry, guys, I couldn't find my unmute button. I think that happens to me every time I present. I think we can all agree that one of the most important things that we can do for families is to reach those families that are struggling or stressed and offer them some form of an accessible lifeline that effectively addresses the changes they face. But as Lacey talked about, in a state the size of Texas, We know that we cannot do it alone. We rely on our partnerships and ongoing support, both at the state, but also partnerships within our counties. We really understand that creating opportunities that capitalize on the strengths of parent and children together to build healthy families and resilient communities relies on all of our systems aligning and the robust partnerships, again, that we can build across sectors. In 2020, during the pandemic, the agency where I'm housed at right now, which is our child welfare agency, and our Health and Human Services agency, where Lacey and Lillian are housed, we began, I don't want to say we began working together because that seems like we hadn't been working together. We've got a long history of working together, but we really began focusing in some of our efforts to building out our processes to really start understanding how do we fit together? How do we support the work on the ground, right? The pandemic, everybody was going through this unprecedented time together where we really started to see the need for partnership and working together. And so I think, that work brought together a new level of coordination and thinking about what's next for Texas, what's next for families, where do we go? I think we started to recognize the critical importance of making like this concerted effort at the state level to develop a shared understanding and identifying some common goals that we could all hold on to try to keep our work moving forward. And so I think with those efforts, our systems were able to take steps to start aligning around this collective multi-pronged approach that each agency ultimately identified with, individualized, and infused within their systems. So it all looked different, but we still had these four core pillars of professional development for our staff, education for our community partners, really trying to think through how do we leverage data as a state and as a statewide system. And then really looking at policies and practices that we could leverage to identify and change systemic barriers that either we were experiencing trying to coordinate or that that we were hearing from our communities that our families were experiencing, and really trying to think through as a state, if we can coordinate and rally around some of these barriers and try to mitigate those, we really felt that at the community level, that would just really strengthen those partnerships. So I think all of those efforts that we started thinking about these four pillars, right? They've led to various projects, work group, multiple conversations that we've had really to try to keep our work moving forward. But the thing that was super helpful, I think, was having these kind of four pillars that we held really strong and kind of held on to during that time. Uh-oh, there you go, sorry. Okay, so really looking at kind of gaining momentum, kind of what happened and where we went. I think it was really important for us to hear about kind of where Texas has been. So I think, over the past 17 years, so I'm gonna do a big throwback. Y'all bear with me. I promise I'm going somewhere. But over the past 17 years, we've done a lot of work to really try to leverage our statewide partnerships to help shape programs and support to ensure families have what they need before there's a crisis. I think we'll talk a little bit about it, but just to kind of give some context to the graphic that you're looking at on the slide, you can see on the outer rings, right, where we have state, community, and state. But then in that inner circle was really kind of what we've been focusing on. Like, right at the state, we really worked. So if you're on the top right quadrant, at the state, we really started working around aligning around those 4 pillars, right? We started promoting some of that within our communities to say, this is what we're focusing on. This is moving the work forward. Our communities were then able to align around some of those, and we'll kind of dive into those a little bit as we go. Yeah, and I'm seeing the chats blowing up. CRCGs, we're totally going to talk about those here in a little bit. But then at the state, we were able, after our community aligned around some of these components, we had conversations with them. And then we were able to identify things that were working at the state level, both at the state and the community, identify barriers, identify gaps. And then we just kind of kept this process going where we would align around some concepts, we would promote them, our communities would align around them, we would identify barriers, gaps, etc. So again, kind of talking back through the past 17 years, I'm just going to highlight a few things that have happened that I think kind of give you some context to some of these coordinated efforts that we've leveraged to really gain momentum. So in 2007, the Supreme Court of Texas established the Children's Commission, which really leveraged judicial leadership and informing policy and practice that were impacting our child welfare systems in Texas. From there, we had our Texas Early Learning Council, which was sorry, y'all. It was established and it serves as our state's advisory council on early childhood education and care. In 2013, we built out our community resource coordination groups and began implementing the Texas system of care, which Lillian will talk more about in a little bit. In 2014, the Early Childhood Systems Integration Group, again, another collaboration of statewide agencies, and began working together to identify, coordinate, and implement cross-sector initiatives for young children and their families. In 2019, the Texas Early Learning Council that we talked about earlier did this statewide birth to 5 needs assessment and developed a strategic plan as part of Texas's preschool development grant project. In 2019, there was a collective group of agencies that pulled resources, and we held our first pediatric brain health summit, which was designed to elevate early brain development as a crucial pillar of child health. Those brain health summits have continued since 2019 and have been very impactful. We also started establishing Help Me Grow as a system in Texas in 2019. And then March 2020 happened and everything came to a standstill, right? And we knew that by leveraging our systems, by leveraging our partners at the state level, that had created this huge momentum. And so I think, like other states that I've had the privilege of talking to, and I know Lacey and Lillian have as well, the pandemic really created this springboard opportunity for us to really re-envision our work, kind of dive in, figure out how do we keep supporting families. Their needs overnight changed drastically, right? Everything changed. And then over the next 2 years, families' needs were ebbing and flowing and constantly changing. And so, I don't know about Lacey and Lillian, but I kind of constantly felt like I was blindfolded and spun around. And it was like, okay, now throw the dart at at your dartboard and try to hit a bullseye, right? And that was kind of this momentum that we had. But I think, we were able to really leverage that as an opportunity. Let me see, we began to start looking at each other. We overnight, we were changing our resources, we were changing our websites. We launched a very diverse stakeholder group, if you will, that were state agencies, it were nonprofit, philanthropic. It was all of these partners in Texas coming together to really start thinking about, what are you doing? Like, what is everybody's swim lane? Where is everybody working? What are the gaps? How do we keep this work moving forward, right? And then we had the opportunity, like amongst all of this happening, we had this opportunity to apply for the round 2 cohort for the Thriving Families, Safer Children systems change, right? And so we thought, ooh, like there's a lot happening, but the focus really for this round 2 was looking at co-creating with parents, youth, caregivers, like this infrastructure to support and strengthen children and family well-being, right? And we were like, if there was ever a time to really double down and focus on that, like this is it, right? So Texas, we jumped on it, both our executives like signed off on this MOU overnight. Everybody was super excited. And so we got accepted. And so that was really kind of our first, again, what I say our first, it was our second way to start really like focusing together as a state to say, okay, right, we know lived experience is important. And we know, like, if we really want to build the most important, impactful programming that we can't do that if we're not asking the consumers of these programs, what do you like? What's missing? What can make it better? What made you like seek help now? Why now? Like, and start asking some of those questions to figure out how do we do more? How do we do it better? And how do we build these services and supports for people that need them, but really designed by people that need them? How do we do that, right? And so that began a whole other like long conversation that we've been having, and we're still having it, right? But I think for me, this really helped shape our desire and our expeditiousness, if you will, to really start elevating this work and elevating lived experience. And so I was really excited. In 2021, I created a position on my team with the support of my leadership, and hired our first parent partner, which is somebody who was hired specifically because she had lived experience within the child welfare system, but also in using some of our prevention services. And so we're able to really start thinking about infusing lived experience at the state level, at the forefront, at the very beginning, when we're having conversations about what's next, what do we want to fund, where are we going? So that was really exciting. And then her first big project that she did was to build our first statewide prevention parent advisory council. So our grantees at the local level had their local PACs or parent advisory councils, and they were learning so much from these parents. We modeled after them, right? We went through this whole align, promote, align, identify, right? We identified that our communities were able to leverage these PACs and leverage them in such an impactful way that we wanted to align around what they were doing. So I think this model goes both ways, right? Like, we're learning from communities, we're building partnerships to support what communities are doing. But anyway, we were able to form our first parent advisory council. It's made up of representatives of parents from across the state, all who have served on a local parent advisory council. And we have gleaned so much from this incredible group of parents. I think that was one of those game changers, in my opinion, in the work that we've done over the past 17 years, was really being able to pull this group of parents together to run ideas by them. And so I know we'll talk about some of our surveys and some of the things we've done, but we've taken all of this to our parents and said, hey, like, if you were asked to fill this out, what would be the best way to fill it out? What doesn't make sense on this? How do we pivot? How do we leverage what you're telling us and what really works and resonates with parents and make a product that's even better? So I think, those were some of the things that we started doing to kind of build this momentum and fill in the gaps. And before I turn it over, I'm going to talk a little bit about like the transferring locally and the coalition building and some of that we've done. But I wanted to ask you all a question. What are some of those game-changing partnerships that you all have had locally or that you've started? Like, yes, thank you so much, Bridget. Lacey started this off, but like we wanted to share what we've done, but we are here to learn from you just as much as y'all are here to hear from us about what we've done. So I would love to hear, as we keep talking about some of these coalition building and some of these local things that we're doing, who's a game changer for you? Who has been instrumental? I started this by saying leveraging lived experience was a total game changer, right? I think as we've been able to build partnerships at the state level, we've been able to build some of these statewide partnerships and groups. But I think locally, so I'm going to keep going as I'm waiting on you guys to tell me some of your game changers, right? But locally, all of the prevention and early interventions grantees, they're all required to either have a coalition or be a part of a coalition. And so we believe that coming together in communities or at whatever your community may look like, whether it's a regional, whether it's a community, whether it's the state, coming together, sharing resources, learning from each other has been instrumental in pulling off some of these really cool things that I think we've done as a state. And coalition building is where it's at, right? We know that partnerships are instrumental. We know that trust is instrumental, and the way you build trust is by leveraging those partnerships. So locally, we've been able to do some of that through coalition building. Like a lot of other states, we jumped on the Family Resource Center bandwagon, and we are huge fans of those. I think it's my favorite thing about Family Resource Centers is once you've seen one, and it's so true, right? Like they're all different. And I think that's the beauty of a Family Resource Center is they are built in a community, by a community, focusing on what are the needs in that community and that providing that place-based support. So that's some of the things that we've been able to pass down. And I'm going to turn it over to Liliana to talk about the systems of care and CRCGs.
So at the state level, the Texas System of Care is overseen by a governance board composed of representatives from the 6 child-serving state agencies, youth and family members with lived experience, representatives from a few local mental health clinics, nonprofit organizations, and higher education. And this governance board, it's the Children and Youth Behavioral Health Subcommittee to the Behavioral Health Advisory Committee. And the Behavioral Health Advisory Committee advises the Texas Health and Human Services Commission on behavioral health topics overall, including mental health, substance use disorders for both children and adults. And they provide guidance and recommendations to the Health and Human Services Commission, to the Executive Commissioner, and also to the Texas Legislature. So the Children's Subcommittee, the Children and Youth Behavioral Health Subcommittee, that group develops recommendations for child and adolescent mental health and behavioral health services, supports, policy recommendations, and those recommendations get delivered to the Behavioral Health Advisory Committee, who communicates them to the Health and Human Services Commission and the Texas Legislature. And the governance for the Children and Youth Behavioral Health Subcommittee is open to the public. So the meetings are, right now they're being done virtually because that allows more participation from across the state. So in addition to the formal members, with this meeting being open to the public, we have people from across the state joining into the meeting, being able to provide comments, participate, contribute to the discussions that are occurring about how to strengthen mental health services for children and youth, how to build collaborations, how to partner more effectively with youth and family members with lived experience. And so that is one structure that we have in the state to help develop and advance the Texas system of care. And another structure is a memorandum of understanding, which has been established among the 6 child-serving state agencies to delineate their responsibilities and contributions to the development and advancement of the Texas system of care. And the Memorandum of Understanding is responsive to state statute that Texas has to implement the system of care framework and to establish this MOU and to help local communities develop their own systems of care. And so to implement the statute, we have this Memorandum of Understanding, and then to help transfer the knowledge and the system of care model to the local community, the Texas System of Care team at the Health and Human Services Commission partners with the Texas Institute for Excellence in Mental Health at the University of Texas at Austin. And together we provide training and technical assistance to system of care communities across Texas, helping them to implement local governance boards, collaborations with the child-serving organizations in their area, and innovative children's mental health services and supports. And then in turn, these communities provide feedback to the Health and Human Services Commission, and we incorporate this to improve the overall Texas system of care. And then, and so I also want to mention, so that the Texas system of care with at the local community level, with the child-serving organizations coming together, they meet and they discuss what the child-serving mental health system of care looks like in that community, what it needs, what is it missing, what are the strengths, who should be included, who should be at the table, who works with children in the local community, child welfare, juvenile justice, the local pediatricians, the hospitals, the child-appointed special advocates, the local Goodwill or the community center. They should all be involved. And so at the local level, the group meets and they look at what the system of care looks like for children and what's needed, and then they work together to fill the gaps. And if they notice, for example, that interpreter services are needed to help children and families who who need supports to be able to hear during meetings, then those child serving organizations can contribute funding. They can blend their funding or set up a funding mechanism to hire an interpreter to be part of their system of care and be able to equitably serve all children and families. And then, so they do this at the community level to look at the overall children's system of care and what is needed. And then for individual children and families, we have community resource coordination groups in Texas. And these are county-based groups with representatives including mental health, child welfare, juvenile justice, education, vocational services, hospitals, housing, and child appointed special advocates or CASA, and other local community members. And they conduct staffings for children and families. Community resource coordination groups also conduct these staffings for adults in need, but focusing right now on children and families. These children and families have complex multi-agency needs, and they are referred to their local community resource coordination group to conduct a staffing. And during the staffing, the group of people who are gathered at the table, they hear the family story, they discuss what services they are able to provide, and then they give recommendations about what might be helpful for the family based on the strengths and needs that the family presented. And then the family is able to choose which of the recommendations they believe would be most helpful to them. And then the chair or coordinator of the community resource coordination groups connects that family with the recommended services that they consented to. And so that's how it works at the local level. And at the state level, at the Health and Human Services Commission, members of my team provide training and technical assistance about the Community Resource Coordination Group's process, about engaging community members, collecting and reporting data, and available resources at the state level. For example, what resources are available to children who have co-occurring intellectual and developmental disabilities disorder? What resources are available to them? What resources are available to children who need blind services? And so we host webinars to discuss the services that are available. And so at the local level, they know that these services are available and can connect their clients to these services. Community resource coordination groups also provide input about what is occurring at the local level, and they provide information about what would be helpful for enhancing the local system of care. So if there is a resource that one of their children or families needs and it's not available, they can communicate that to their local system of care if one exists, or they can communicate to the state community resource coordination groups team, and we become aware of this need and we can help to fill it and help the community to figure out how to access it.
Before we move on to the next slide, there was a couple of questions that came in about the PAC that I've been asked to go ahead and address publicly. I did address them in the chat, but I know I've got a couple of people that have called in and may not have access to the chat. So I just wanted to say the first question was, do you compensate your PAC members for their time? And the answer is yes. We pay them, they meet monthly, and we pay them every month for that meeting. And then they have the option to provide additional supports in between the meetings, whether it's like doing some defining or like defining a term that we're leveraging, or just some like personalized self work. So I just wanted to say, yes, we definitely compensate our PAC. The second question that came in was, how do you ensure that parents have access to participation so there is representation of terms of race, socioeconomic backgrounds, et cetera, on our PAC? And the answer to that, great question. The answer to that is we have an application process that we send out to all of our local PACs across the state, where the member and a staff can either or can fill out the application for that person to join our PAC. And then we look at all of the PACs, and what we definitely look at location. So that is our first criteria, is making sure that we have a diverse representation from across the state. And then we look at other factors. So currently on our PAC, I have a kinship caregiver I have two kinship caregivers. Both are grandparents that are raising their grandchildren. I have three fathers. They're from all over the states. They are from very diverse socioeconomic backgrounds. But all of that is part of that application process that we have them fill out. And then Lillian, I will just say, after, I know you're about to go and talk a little bit more on the next slide, but there are some good questions and or not questions, but more comments, kind of focusing back on the systems of care that you should look at after you're done talking again and I start talking.
Thank you. Okay. There is a great question in the chat about ways you have found helpful engaging with schools to promote available resources. And so this is a great segue into this next section of the presentation. And so first I'll speak about mental health first aid and then about school-based mental health. So mental health first aid trainings are provided across Texas by the local mental health clinics to school personnel, employees of higher education institutions, emergency responders, service members, veterans and their family members, and other community members to teach about signs and symptoms of mental health challenges in children and how to respond and connect the child and family with mental health support. And so right now, we have the Health and Human Services Commission contracts with the 39 local mental health clinics across Texas. And the local mental health clinics receive both state funding and federal block grant, mental health block grant funding to conduct the mental health first aid trainings for the individuals that I spoke about. And then once the trainings are completed, surveys are distributed by the local mental health clinics to measure the effectiveness of the training and how it's used. So the people who received the mental health first aid training, they can provide input about whether they now feel more confident speaking with a child about mental health concerns. They can respond about whether they feel more competent, recognizing signs and symptoms of mental health challenges, and whether they can also provide input about whether they have actually used their mental health first aid training. And so every year we provide a report looking at the results of the survey, and then we share them, those results back out with the state as a whole. So for school-based mental health services or screenings and services, we have two ways of doing this. And the first one is through Project Aware, which is advancing wellness and resilience in education. And this is a federal grant awarded by the Substance Abuse and Mental Health Services Administration to the Health and Human Services Commission. And in this grant, at first, we partnered with the Hurricane Harvey affected region in the Gulf Coast, and that grant is wrapping up this month. And now we're partnering in the second Project Aware grant, we're partnering with the Central Texas region. And in these partnerships, the local mental health clinics hire clinicians who are deployed to the schools that they partner with, and those clinicians go to the school and they conduct mental health screenings and connect the children with the appropriate services for their level of care. So it might be mental health support groups in school. It could be a referral to the local mental health clinic for more formal therapy and social skills training, anger management. And if a child is sent to the local mental health clinic, or referred to the local mental health clinic, those therapy services and wraparound, they can still be provided in the school setting where it is convenient for the child and for the family, so they don't need to also travel to the local mental health clinic. They can access those services in the school setting. And then very similarly, the Texas system of care, we currently hold a grant from the Substance Abuse and Mental Health Services Administration awarded to the Health and Human Services Commission. And our current grant began in August 2021 and runs through August 2025. And the focus of this grant has been on school-based mental health services. And so what we set up in our 3 communities, the first one is Travis County. So we're partnering with the Austin area. The second community is El Paso. And the third community is to the west of the Dallas-Fort Worth area. And so in these communities, the local mental health clinic receives grant funding from the Health and Human Services Commission to hire a team, including a youth peer support services provider, a family partner, a mental health, school-based mental health interventionist, and a school-based therapist. And these 4 individuals go into the schools that are part of this collaboration, and they conduct mental health screenings, they provide therapy, they provide one-to-one youth peer support services. The family partner meets with family members, and there are groups led by the youth peer support provider for groups of youth. There are group therapy groups led by the therapist, and they are implementing innovative school-based services. So these are services that are evidence-based, but not currently in the state Medicaid plan. So we're piloting these new services and seeing how effective they are and whether it would be beneficial to implement them statewide and potentially include them in the state Medicaid plan. And then for community resource coordination groups, so I described what they are, and I saw a question in the chat about how to get the information to the needed people. And so a lot of what we do is holding webinars and trying to connect with our partners at the state level, so they're aware of both community resource coordination groups and the Texas system of care. And so these state level partners can then disseminate the information to their local representatives. But there is still work to do, and we know that at the local community level, there are still professionals, for example, in juvenile justice, who have not yet heard about community resource coordination groups. And so to remedy that, we are currently starting a new project for community resource coordination groups where we're expanding, and we're currently hiring regional coordinators for the Community Resource Coordination Groups program. And so right now at the state level, we have our Community Resource Coordination Group state coordinator, along with 2 program specialists. And they've been providing all of the communications, newsletters, webinars, training and technical assistance, data collection and analysis to the local community resource coordination groups. And now we're hiring the 6 regional coordinators. And so Texas's 254 counties, and so those 254 counties are divided up into about 141 community resource coordination groups. Not every county is covered by a community resource coordination group at this time. About 8 counties that still don't have one. And so that's something we want to fix. We also want to have every community resource coordination group serve both children and adults. And right now there are some who only serve children and others who only serve adults. And so we want the entire lifespan to be covered. And so the 6 regional coordinators will have a cohort out of the 141 community resource coordination groups. They'll have their region, and they will help their region to make sure that the local community resource coordination groups in the region, that they are strong, that they have the appropriate partners from the local community participate in staffings, that they have engagement from the local community. We want to make sure that the regional coordinators help the local community resource coordination groups with marketing and advertising to the local community, with information dissemination to schools, to the local probation department, to child welfare, to pediatricians' offices, so they all are aware of the resource that's available, that if they're working with a child for whom regular case management hasn't been effective and the child is struggling with several agencies involved, the community resource coordination group can help manage all of those agencies and help connect the child and family to resources that they haven't used yet, that haven't been identified for them in the past. And those resources are the ones that could potentially help a child to be successful and to improve their quality of life. And that's what we've heard from the success stories. And so the regional coordinators for the community resource coordination groups will be able to provide that localized support. They'll be able to hold summits for the local community resource coordination groups and have the local representatives from the organizations meet together and become engaged in their local community resource coordination groups. And now I will turn it back over to Brooke.
Thanks, Lily. There's some questions that happened in the chat, and the chat has blown up, so you guys keep it coming. I've lost some of them, but one of the ones that I found and I wanted to circle back to really fast before I start talking about our programs is the in what ways have you found helpful engaging with schools to promote available resources? So I will say, like, one of some of our family resource centers are co-located in schools, and I think that's been super helpful as a connector point. But I think all of those connections are really best served locally and on the ground. And so I know we create flyers about our program. Same thing that's in the chat, right? We've got flyers. We put out a parenting tips calendar that we share with schools that schools can order. So there's a whole host of ways that I think kind of engaging to promote resources is helpful. But again, it all starts with those local coalitions. And so if you don't have somebody from your local school board or school, like it's your school agency, or the superintendent, like at your coalition meetings, like that may be an interesting connection and an interesting time to bring a new partner to the table to really try to share resources to strengthen your community. I think that definitely aligns with what I think that they would want, and what we've seen across some communities here in Texas. So as I kind of talk about the prevention and early intervention programs, I'll just say we fund 8 core programs that provide support to 3 different categories of parents, if you will. So we have those that provide supports to parents with young children, so those under 6. So these are our programs where you're looking at more of your like home visiting programs and home parent education programs. We have some programs that provide supports to parents with teenagers specifically. So kind of looking at that 6 to 17 age age group. I just totally made up a whole new word there. And then we have some programs that are designed to support the entire family. And so I will say through the majority of our programs, we're offering some type of parent education that is really designed to mitigate conditions that result in negative outcomes for children and youth. But additionally, some of those other efforts that we're doing, and specifically, like there's a whole bunch of things that are happening, but I'm going to kind of hone it in specifically to the mental health bucket, if you will. So we have programs that do specific crisis intervention. So there was a question earlier about, like, in Texas, right, we're really large. We've got big resource gaps and areas where there's resource deserts, if you will. And so our main program that provides support to parents with children 6 to 17, we have statewide coverage. We are in all 254 counties with that program. And that program is really designed to provide short-term crisis intervention, family counseling, maybe mitigating some of the behaviors or risks that you're seeing in younger children before you can get them onto a local LMHA. So there's been some connection at the local level to try to bridge some of those gaps that we have. I think the other things that our programs are really trying to do, we have one program that specifically focuses on zip codes in Texas that have a high rate of juvenile crime. And these programs are designed to alleviate family conditions, both in the family, but also in the broader community, that could kind of put children on the path to juvenile crime. So it's creating safe spaces. They do community beautification projects. They have youth leadership programs where they're developing the next leaders in those communities. Pretty cool program, I think. We also fund Nurse Family Partnership in Texas, which, for those of you that don't know about NFP, it's a program that serves first-time low-income mothers or parents that starting by their 28th week of pregnancy. So they have to be enrolled by 28 weeks of pregnancy, but that nurse home visitor will stay with that family until that child reaches 2 years of age. And really one of the things that program is trying to do is improve mental health functioning, both for the mom and the kiddo. We also have programs that focus on doing depression screening and referrals for moms, and then developmental screenings and referrals for kiddos. So those are some of those programs that we're funding, or like at a high level, and really some of the things that they're focusing in on. I know Lillian was talking about mental health first aid earlier. And one of the things that we're starting to fund more and more of across the state, that kind of, it's not mental health first aid for sure, but the conversation kind of made me think of it. Well, we're doing parent cafes or dad cafes, or for youth, we're doing WOW cafes. So they're safe places where families can come, and they have a peer support group where they can talk about challenges that they're facing. They can celebrate their successes. If they've learned about a new type of training, or that they've gotten mental health first aid, right? They're bringing that back to say, hey, I had this thing, right? So I think that these parent cafes are things that are really starting to take off in Texas, and we're promoting a whole lot here. So I think, yep, I think it's time to go to the next slide. That is our programs at a high level. I'm happy to share more context or more information about any of those. But let's go to the next slide. And Lacey, I think that's you.
It's me. Yes.
Yeah.
Thank you. All right, so next we're going to talk about lessons learned so far from everything we've just talked about, and also some innovations that have come about from it. And I'm focusing this on a lot of how we demonstrate these outcomes too. And so for a long time, Texas Health and Human Services has largely relied on outputs to demonstrate our success. And many of our key measures put in place by the legislature rely on these outputs for funding. So they're very important. They're still extremely important for meeting our basic program requirements and maintaining compliance at the state level. However, outcomes can be used to tell a story and promote innovation and prioritize our funding, and ultimately build more effective programs that truly do benefit Texans. And so what we're learning, and what we have learned, is that we need to show the impact of outcomes on Texas communities. So in Texas, we have some areas and programs where we may have figured it out, and we're confident that we figured it out in those. But the real challenge for us is showing that impact across the broader system, and learning from each other and practicing and testing the different strategies we're using helps us to understand how we elevate these outcomes to demonstrate success in these programs, including which are the most valuable to each program specifically, because we all have different goals to get to those to the end goals for those. And for those outcomes, what's the most effective way to market them? We also are learning and testing how we standardize methods for short-term and long-term outcomes, but also allowing flexibility in reporting based on the outcome goals, depending on how upstream and how long-term it is, and the unique community needs we're seeing. And then demonstrating return on investment for complex or long-term outcomes, and using that return on investment to promote and support future funding and efforts. And so a lot of the things that we're questioning and we're seeing too is, how do we demonstrate some of these interventions given so early on that you're not going to see the results for a few years or 5 years or 10 years? And for others, how do we identify the risks for seeing those results that can happen along the way? Or do we just accept that there's going to be other factors and risks, and for measuring these outcomes based on our services? And one thing that we have just recently started doing, we had recent legislation that allowed us to utilize many of the lessons learned to develop the Smart Innovation Program. And that program is meant to empower communities to develop systems based on their unique need. and it hasn't been implemented yet, so we don't have results, but we are in the final stages before it begins later this summer. And developing this program, we met with key individuals from several state agencies, including the Texas Juvenile Justice Department, Texas Education Agency, Texas Workforce Commission, and University of Texas. And we developed a work group internally with Brooks area and Lillian's area to understand what's being done, what is innovative, and most importantly, how do we measure it? The result of our efforts was a procurement that pulled in relevant portions from each of these areas and our area and family health services as well. And some of the things that we're looking at, like I said before, in that flexibility, we're looking at how do we demonstrate that using the prevention and intervention programs that Brooke works with. We got a number of qualitative data pieces that have been really relevant and assisted us in measuring the success of the program, or hopefully will once it starts, of course. And then behavioral health services had been working with a system of measurements that grantees could select from, like a menu, actually. We loved that idea, and we used parts of it to allow our grantees to really propose their own methodology for how to get to these outcomes, and potentially using some of these, but also like, is there something in your community that you want to start measuring? Maybe it is some local rate that's associated with it. Maybe it is just the not being involved in juvenile justice later on, or the having intensive services later on. And so it's been a really unique experience, and we're looking forward to seeing those results. Now pass it to Brooke.
All right. And so I think, you know, another thing that the pandemic gave us was a lot of these ARPA funds and a lot of ways to try to really support families and communities, right? And so I think out of that influx of funds, we were able to put forth some of our some innovation grants, right? So we in PEI, or the Prevention and Early Intervention Division, we're pretty unique as far as like a parent education cohort, if you like, a group of programs, right? A lot of other states, we've learned, like, they will maybe fund one particular model and deploy that statewide. But as we've talked, Texas is really big, it's really diverse. Communities look different. Even our urban communities are different. Our rural communities are different. And so we allow grantees to tell us, like, we want to use this particular model and do this particular thing in our community, which is super great. Like, that flexibility to let the community drive and build programming for them that's going to meet their needs, I think has been really successful. It also means that we're looking at a lot, we're measuring a lot. There's a whole lot of different measurements that are happening. But I think some of the things that I will say about our innovation grants that it let us do, right? So we're now funding some of the infant and early childhood mental health consultation, right? We're doing some mothers and babies supplement, some of that curriculum supplementation. We're funding more Help Me Grow sites. We've got one site that pitched this mobile wellness wagon, right? So it's a mobile unit that goes to where families are and provides support there on the scene. We're funding more promotores to really support family well-being and safety. And I think, you know, because we've got this flexibility, we definitely have the outputs that we're measuring, right? So we want to know the numbers that we're serving. We want to know annually, monthly, what does that look like? But we're also leveraging the Friends National Center for Community-Based Child Abuse Prevention, the Protective Factors Survey, right? So it's that 20-question survey that covers the 5 protective factors. We're also doing program experience surveys with our participants to get their feedback about specific programming. So I think, you know, as we've tried to continue like this community flexibility, we're also still trying to capture some of that outcome qualitative information to really help us build and design programs and continue to support, right, and promote this idea of community flexibility in the programming that they're going to leverage. I think that covers everything that I was going to say on that slide. I'm also watching the time and know how chatty I tend to get, so cut me off.
So we have 10 minutes for our discussion before we start with a wrap up. So I'm going to move us on to the discussion slide. And we have prepared some questions for you. And we can also, I don't know if there's any in the chat that we haven't addressed that we want to either. We're happy to do that too. But for our first discussion question is that standardizing piece, but still allowing for flexibility. Have you guys come up with anything that has been really valuable for you that is both standardized and flexible? And then I can go ahead and read these other questions. That way, if there's one that speaks to you better, you can definitely hop in on that one. What structures and policies do your agencies have to ensure alignment of goals and progress across the entire continuum of care? Data or service? That's a good question, Lindsay. Lindsay asked, are you talking about standardizing data or services? We were talking about standardizing data, but we're open to talking about standardizing services, I think. And then the third question is, how do your agencies employ outcome data to illustrate successes or needs?
Hi, this is Dion. If anyone has a response, please feel free to unmute and, excuse me, just share aloud. That would be great so that we can have a discussion.
I think collaborative problem solving should be a part of trainings, any trainings to establish abilities to communicate well with families.
I love that. I'm sorry, I didn't see who came off and started talking, but have you found any ways that like have worked better than others locally or in your community?
Well, my experience is helping families, and I think just finding ways to communicate with our community partners like the school and school-based health centers, with supporting better communication with youth that are experiencing challenges, etc.
Yeah. Bringing us back to that leveraging lived experience and really pulling from the participants of our programs. Yeah, I think that's super critical.
And the lens is that I'm looking through is, how do we move away from the punishment model into a collaborative model with our youth?
Like punishment, like juvenile probation punishment. Is that kind of what you're thinking?
Yeah, I mean, if we start young, we're in the schools where we have, you know, lunch detentions, then that, then you're seeing suspensions, and then you're seeing expulsions, the school to prison pipeline, starting early on, sort of moving away from that punishment model, because that's what we end up doing, is ending up in prison with our youth. So let's intervene at an earlier time when we see behaviors, because behaviors are what's telling us, the kids are telling us something's not right. They're communicating with the skills that they have.
Yeah.
Are you finding that there are ways to help them whenever they are communicating for early support before the need?
Well, where our perspective is support the family first, like you were speaking to. Yeah, what are the parents' needs? And, do they need them? We have support groups for parents. We have, creating networks of parents supporting each other is very helpful.
Great advice. Thank you so much.
We have two hands raised. Lindsay, I think, was first, and then Blanca.
Yeah, so I will say that social media is huge, right? There are so many parenting groups and things like that that are full of misinformation, that are full of, right, that, like, I think leveraging social media in those types of groups, right, to get out information about your services and about what's available and how to reach them is so important, because those are usually groups of parents looking for help, right, and turning to each other, which is great sometimes and not always, great. So really having people who are in the community and part of all of these groups and paying them for their time, which I think is awesome that you do that, and having them to be able to go into those groups and make those connections and hand out that information is vital.
Yeah. I don't know about y'all, but like word of mouth for our program, like that is like a #1 referral, right? People are going to go where they've heard that their aunt or their cousin or some other trusted person has gone. And so, yeah, I definitely think that word of mouth kind of spreading.
And then we have Blanca.
Yeah,
Blanca.
hi.
Hi.
So I also work with parents, and sometimes I feel like there's not enough resources to support those parents, especially, when they're not so familiar with mental health. Maybe this is their first time opening to it, they're getting to a point where they cannot handle their kid, and this is truly the first time that they're opening to services and they're opening to everything else, and we continue therapy and we continue medication, but the kid is going back to the same environment where the parent is not prepared to support that child. And a lot of the times I feel like the system is constantly punishing and and stigmatizing, the parent, not taking in consideration that gap, that education, that connection, that the father may be also struggling. I see it a lot in my community, my Hispanic community, where the lack of education around these topics is huge for the mother and the father to be engaged into services. Thank you.
Great points.
Thank you, Blanca. And then we have another comment or question from Sean Brown.
Yes, thank you. Um, so two-part. From your experience, the panel, what would be the top two spaces and places where you can probably get the best bang for your buck, right? So meaning the type of services that overall you have that the community may need. Do you find that um, it's in schools where families get those services if it has that community school model, or is it in a community-based organization? Like, in your opinion, what would probably be the best two places for the best bang for your buck? And then number two, what is the um actually I'll leave it for that and then I'll circle back.
Schools are a very much untapped place where children and families can receive services. By bringing the mental health services to the schools, then the children and families are already there. So they're not missing as many appointments. We are working with them to bring the services to them in a convenient location at a convenient time for them. And so if we're making the services accessible for them and convenient, then they're more likely to engage in the services and be responsive to the kindness that's being shown to them.
To answer your question too, I also think balance is really important because you don't want to overwhelm a school system with too many services and redirect the focus from what the children are really there for. And so having that balance and top two services, I mean, you also don't want to overwhelm a system with so many services across the community that they can't navigate what they truly need. And so I don't have an answer. I just wanted to add that comment to that piece too.
Yeah, that is valid because I think in some instances, yes, the school would be ideal. But then to your point, schools are pretty stressed with, what they can do, and whether the funding permits for X amount of social workers as opposed to psychologists, yada, yada, yada.
Yeah.
I think the other thing I would add to that, just for consideration, is, I don't know that there is a right or wrong pathway, right? I think it's going to look different community to community, place to place. I think the more important question is, where is that safe place for families, right? Schools, unfortunately, are not always a safe place for every child going there, or for families. There are problems, right? Community organizations may or may not be a safe place. So I think it's trying to balance all of these things that we're talking through, right? And trying to meet families where they are, trying to make sure that we're not bouncing them around constantly to a whole bunch of different places, but also that they're in a safe place where they're not like pointed out, especially looking at like mental health resources, right? If you think about where families go for that, like a school may be a great place for it because kids are already there. There's no like, oh, I saw, especially in like a really small rural community, somebody going into a local LMHA like could be a deterrent, right? And so I think I think it's like an onion, right? There's a whole lot of layers that you've got to kind of peel through, and maybe it's a yes and, right? It's not one or the other, it's a both type of situation. So that would be the other thing that I would add on to what my colleagues have added.
Wonderful. Thanks, Brooke, and thanks, Sean, for your question. I think we have time. We have Nikita. Do you have a comment or a question? I just want to honor the fact that your hand is raised.
It's more just of a quick comment when Sean was asking about if schools are the best. I know I'm from the state of Ohio, and I am part of the Ohio School Wellness Initiative, and some of our and my position is a behavioral health and wellness coordinator. So I'm contracted through a community-based organization to work within the schools, and we provide wraparound services for our students and our families. And it follows that model of just meeting the parents where they are, right? You can definitely promote wellness within the student, but you also have to take care of the family. So we do that. Like my job is to be the community facing as well as coordinate the service within the schools. But I coordinate with local mental health agencies, our Akron Children, school-based health. We have dental services, we have optical services, and we do these things in the school to break down the barriers that are actually like transportation of getting your kids to these appointments. taking care of those assessments, getting them in. We also make sure that their therapist or their psychiatrist are able to meet with them during times that are opportune for the school so that they're receiving the services that they need to meet the needs of the student and the family. So I agree, it definitely depends on the city. I'm what we consider mid-size urban, but that's how we've coordinated our services, including food pantries, like working with the local food pantries. We have a Sleep in Heavenly Peace where we 2 times a year make beds and deliver beds all throughout the year so that our kids have somewhere safe to sleep. So it's just, I'm a firm believer that it starts in the school. As oftentimes when I went into this position, I sat and I looked at everything that the district that I'm in, that they do. And it's kind of like they can't teach because they're doing too much social work. So if we can mitigate and take care of all those, meet those basic needs, then they have the ability to get back to being the institution of academia.
Thank you so much, Nikita, and thank you all for joining our training today. And a wonderful thank you to our presenters, Lacey, Brooke, and Lillian. This was a thorough, comprehensive, and very informative training. I know we could talk for another hour, and maybe we'll bring you back to fill us in on how things have been going in Texas. But I just wanted to wrap us up today and thank everyone for joining, and to remind you all that you will be receiving the recording, the PowerPoint presentation, and a certificate of completion. Please don't forget to complete the survey. We really need to hear back from you to continue to provide these resources, and that's how you'll claim your continuing education credits. And just said that, and then here's some contact information for how you can stay connected with us. And thank you all so much for your time and attention today. We really appreciate you joining us, and thanks again to our wonderful trainers and presenters. Have a wonderful day.